today we are talking about the Tomatis Method's process. I am Francoise Nicoloff, a French-Australian registered psychologist and the director of the Australian Tomatis Method based in Sydney. I'm also an international Tomatis trainer and speaker, and I've been working with the Tomatis Method for 40 years and more. So in the process of undergoing the Tomatis program, we start with an initial assessment. In that assessment, we are able to review the history of the person and its development, and we send you questionnaires, and which gives me the ability to know a bit more before I meet you to understand what's going on. In the process of the assessment, we also go through a listening test, a Tomatis listening check, and we discuss about the results of all of that. So regarding the listening check, we measure many different things, but above all is bone and air conduction, because we have two ways of processing the sounds, which is through the ear, it's obvious, isn't it? But also through our bone structure. So we are able to measure that with the Tomatis listening check. So with the program, usually the Tomatis practitioner or consultant will design a first program of listening, which can go for 20 minutes to an hour and 20 minutes per day, and for a duration of 10 to 15 days for the first program. Then after a break of 4 weeks, we do a second program as well. And that program usually is a 13-day program, again, between 20 minutes and an hour and 20 minutes, depending on the age of the child, depending on the conditions as well, and what the issues are. And every time we do a program, we do a listening check if it's possible, or we do a consultation. So we reassess every time between Tomatis programs. So once the two first programs have been done, then we might go to a third, a fourth, and a fifth program, depending on the conditions that we need to address. So there is always the listening, and then a break, a pause for integration, and then there is more program to come. In between each program, we reassess the person as well. So what is interesting also is in terms of what Dr. Tomatis did. He was a French ENT, and he started to develop the Tomatis method about 70 years ago now. But one of his discoveries was the right ear dominance. And in fact, if we use our right ear to focus, it can improve not only the quality of the voice and the quality and the fluency of the speech, but also it helps you understand quicker with no delay, pretty much. And it's also eventually enabling better emotional and behavioral responses. So how is that? It's because the right ear is connected to the left brain where the sound is processed, where language is processed. In the head, our nerves are crossed, and then the right ear is connected straight away to the left temporal lobe where sound is going to be processed. If I'm processing and focusing via my left ear, the information is going to go from my left ear to my right brain, and it's not where the sound is processed. In fact, it has to add another circuit to go to the left temporal brain. So it brings more delays. It brings more difficulties in processing sounds. And in fact, if I was speaking into my left hand, and you can hear the sound of my voice, you can hear that my voice might be duller than it was before, and you can also see that my speech is becoming more hesitant. I have to look for my words. It's more difficult for me to get access to my words. Whereas if I do speak into my right hand, you can hear the sound of my voice and the flow of my speech. Suddenly, all the words are coming in the right flow, and I'm very much not hesitating to do that. So it's very important to understand this discovery of what Dr. Tomatis did about the right ear dominance or the left ear dominance, because it has an effect in the way that we speak, in the way that we also perceive and receive language. And it introduces delays, which can also be at some level involved in some emotional components as well, and also involving coordination. So this is part of what we do. So with the right ear dominance, which we do work on, it helps with better understanding, better quality of reception and expression, and better emotional and behavioral response. So we have also an active phase, which is very important because that's how Dr. Tomatis started originally, was to introduce, to help singers and people coming to him, to help them to talk better, because his issues were with singers who could not sing in pitch anymore. And then he started to have them to practice talking more and singing again through microphone and auto feedback from their ear into their brains. So at any stage of the Tomatis program, we might introduce the active phase. This is a situation where the person is listening to their own voice, which can be through singing, reading, or talking through a microphone. And this is going to allow the person to practice self-listening and eventually to learn to control their voice with the help of modification done on the earphones, on the headphones, and the talk-up parameter, like you can see them here. So another discovery that Tomatis did was the prenatal life, the importance of the prenatal life in our own life. He was a pioneer in the field of prenatal life and understanding that listening starts in the womb. Listening can be compromised through the conditions of the pregnancy in terms of stress, trauma, physical or emotional difficulties experienced by the mother-to-be. And the Tomatis method, in fact, offers a positive ways of revisiting that special time by recording the mother's voice and having the child to listen to it filtered. What happens is at 4.5 months of the pregnancy, we know that the ear is totally finished. And what the baby in the womb is hearing is the breathing, the but also the heartbeat, boom, 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 and also all the pipes, the pipes in the tummy. But from time to time, the baby is going to hear a little and this is the mother's voice coming through the vibration of the spine and going through the amniotic liquid and going to hit the bone structure of the baby. So that's where listening can start, when the baby is going to wait or try to look and predict when this little sound is going to come to him or her. And that's what we do when we do the Tomatis method, and we are at the level where we can program mother's voice recording. This is the work that we are going to help to revisit that special time where listening can start. It might have started or it might not have started. So it's another way to revisit that period and to help the child or the adults to overcome their difficulties. And so it helps with processing skills and to develop listening skills as well. So all these settings are combined together to produce the best results. And depending on the level of the Tomatis professional training, practitioners and consultants have access to the features that I've described above and allowing them to individualize programming to suit the client's needs. The Tomatis professional training is only provided to professionals who work in the field of health and education. Thanks for watching this video. And if you want to know more about the Tomatis method and how it can help you or your child, you can visit our website, www.tomatis.com.au, or listen to our radio podcast, which is the Conscious Ear podcast. I hope to talk to you soon.